Are you worried about a UTI or a urinary tract infection in your child? Do you want to learn more about what causes UTI? What are the risk factors? What are the symptoms that should alert you that your child is having a UTI? How do doctors diagnose and treat this condition? And lastly, watch until the end because I will give you action steps on what you can do right now to help your child. Hi, I am Dr. Kristine Kiat. I'm a board-certified pediatrician, and in my channel, I give you weekly videos for any question that you might have on a certain topic in order to help you raise happy and healthy kids. UTI or urinary tract infections in children. UTIs are fairly common and majority are caused by bacterial infection in children. UTI happens when bacteria invades and ascends the urinary tract from the urethra to the bladder. And then cystitis or lower UTI is bacterial infection with inflammatory responses that are confined to the bladder. And upper UTI or pyelonephritis is bacterial infection with inflammatory responses that further ascend the ureters and the kidneys. The typical causes of UTI in children are from colonic bacteria, with E. coli being the most common, happening in 50 to 60%, while other causes include Klebsiella, Proteus, Enterococcus, and Pseudomonas. Now, who are most at risk for UTIs? Being male is a risk factor, especially for uncircumcised babies. Another risk factor is poor toilet habits, which is why children are encouraged to pee every 2 to 3 hours. Another risk factor is poor toilet hygiene, which is why girls should be taught to wipe from front to back to avoid introduction of stool bacteria or poop bacteria into the urethral opening. Another risk factor is compromised immune system or bladder function. For example, victims of spinal cord injury who require self-catheterization. And an important risk factor is also sexual activity. So, what are the symptoms that should alert you that your child might be having a UTI? Take note, I will focus on symptoms in children 2 years and older. First symptom, if there is dysuria or pain when peeing. Another symptom is urinary frequency or this need to pee more frequently. Another symptom, if there is urinary urgency or feeling this compelling urge to pee. Another symptom, if there is loss of previously established bladder control like bedwetting. And other non-specific symptoms that you should worry about include fever, especially if it's high. If it's 39 degrees Celsius or 102.2 degrees Fahrenheit or higher, if there is belly pain, if there is flank pain, and nausea and vomiting, if there is blood in the urine. Take note, it is difficult to distinguish a lower from an upper UTI based on symptoms alone, although we are more likely to suspect an upper UTI if fever is present. So, how do doctors diagnose this condition? When you bring your child to your doctor, the doctor will do a history and a complete physical examination. The examination will focus on the vital signs, with fever being important, and heart rate, respiratory rate, and blood pressure, which is important as well. The examination will also focus on the belly, and the doctor might need to examine the genitalia. Because, take note, an uncircumcised male is more likely to have a UTI. Your doctor would need to do additional tests in order to confirm a UTI. This is with a urinalysis and urine culture. An abnormal urinalysis, especially with a microscopic exam, may be indicative of a UTI. And then, this would need to be confirmed with a urine culture that would tell us the bacteria causing the infection, and also the sensitivity to antibiotics. Now, how to get a urine sample. For toilet-trained children, a clean catch urine is sufficient. So have the child clean the genitalia and then do a midstream clean catch. So have the child pee a little bit and then catch the midstream urine and then send this to the laboratory. For children who are not potty trained, a catheterized specimen may need to be obtained. How do we treat it? For cystitis or lower UTI, oral antibiotics are effective. While for upper UTI or pyelonephritis, your child may need to be admitted at the hospital. This is for IV antibiotics and fluid therapy. This is especially true if there is vomiting and dehydration. Take note, when an effective antibiotics is started, there is usually a rapid resolution of symptoms. If your child's UTI is recurrent, there might be abnormalities in the urinary tract. Take note, UTI is not contagious. UTI is not transmitted from sharing a bath with another child, and UTI is not transmitted by sitting on a contaminated toilet seat. Now we go to action steps on ways to prevent a UTI. Action step 1. Hygiene is very important. We are encouraged to wipe from front to back after each diaper change and after using the toilet for older girls. Action step 2. Complete bladder emptying is important. This is because children are in a hurry to leave the bathroom, so they are encouraged to double void or pee after the first void. Also, children are encouraged to pee every 2 to 3 hours. This is because children might ignore the sensation of a full bladder and desire to continue playing. Action step 3. Avoid carbonated drinks and caffeine like in sodas. Action step 4. Avoid bubble baths. Alright, that's the end of our video. I hope you learned a lot and enjoyed watching. I'll see you on the next video. Hi! I hope you enjoyed the video. I am here to provide support and help you raise happy and healthy kids. If you have any questions or if you want to suggest a topic, just type in the comments below. And don't forget to hit like, subscribe, and the bell button to keep posted. Alright?